The disparity between men and women in the workplace revolves around society's need to construct and maintain workplace stereotypes. In the specialist field of obstetrics, gynecology, and IVF, the proportion of male to female OBGYNs is changing. The latest statistics from the Royal Australian and New Zealand College of Obstetricians and Gynecologists shows males currently dominate the profession, at 65% male and 35% female. For IVF specialist David Knight, being a male in a profession society would normally consider more appropriate for females is becoming more noticeable as the years progress.
I never really considered that there would be a gender bias in regard to providing good medical care. When I got into obstetrics and gynecology, it then became quite apparent that there were gender disputes, or in fact even obstetrics gender wars.
Having started out as an obstetrician gynecologist, then moving into IVF, David has been working in the industry for over 20 years and runs a private practice called Demeter Fertility that employs both male and female practitioners. One of these OBGYNs is his partner, Dr. Sonia Jessup.
I think being a woman is certainly easier to attract patients, because although many patients will see a male or a female doctor and they don't have any preference, certain age groups of patients prefer to see females. So, young teenagers often will prefer to see a female doctor than a male doctor for their first sort of gynecology experiences. And there are some religions that will preferentially choose a female.
The current OBGYN trainee intake this year was 30% male and 70% female, indicating a clear shift in gender preference. As the proportion of women physicians in Australia increases, patients have improved access to physicians of either sex, and some patients express a clear preference for female providers.
It's often because male doctors tend to be to explain things a little bit less sometimes to patients. It's more of a paternal relationship, whereas female doctors in regards to fertility often will sit down and talk a lot more with the patient.
Female OBGYNs, when they commence practice, generally find that they become much busier more quickly than males who establish practices. My partners who are female do have busier practices than I do. There may be other factors.
Together the pair are extremely unique and provide clients with an extraordinary opportunity of first-hand knowledge and care. They are the first two IVF doctors to ever have an IVF baby in Australia, Samuel Tiberius Knight, who is now 3 months of age. Despite the figures, the couple believe people are more likely to choose a practitioner based on experience and competency, and love the opportunities they have in helping others create families of their own.
One of the things that doing IVF ourselves, I think, showed to us as practitioners is the first-hand experience of the emotions that go along with it. And we acknowledge the frustration, but living the frustration does add another dimension, I guess, to how we deal with our patients afterwards. I don't think you'll find really any couple who could be more prepared with the knowledge of IVF for what it entails than the two of us.
Alison Brown reporting for Mirror Mirror magazine.